Hello and welcome to Wellness Woodbridge. I'm your host, Kim Cole. Joining me first on our show today is Dr. Pamela Schultz, the newest doctor to join Bay OBGYN here in Woodbridge. Dr. Schultz, thank you so much for coming on the show, and welcome to Woodbridge.
Thank you for having me.
Why don't you go ahead and just share a little bit about your history and how you came to be the newest doctor at Bay OBGYN. I
was born and raised in New Jersey. I went to medical school up in Boston and then came back for my residency. So I just actually finished my training at Robert Wood in New Brunswick.
Okay.
And had worked during residency at the Raritan Bay Medical Center.
Okay.
So it was an easy transition to join the Bay OB practice. I'd worked with all of the other physicians for the past 4 years.
Great, excellent. So welcome to that. I want to talk today a little bit about a topic we've been trying to get on the show, and that's health related to tweens, teens, and young women. What's kind of fresh out there right now of things parents should consider as far as health?
Big topics that are out there, I think, regarding adolescent health. First Lady Michelle Obama has the My Plate, Get Moving campaign, which really stresses the balance of nutrition and getting your kids outside moving, stressing exercise, in keeping their weight at an appropriate level.
So as an OBGYN, what do you see when you see young girls come into your office for the first time?
For the first time, they usually come in for questions about puberty, their menstruation, and a lot of times they come in for questions about contraception.
Sure. And as far as weight and obesity, what kind of effects could that have on young girls?
So the implications of obese children will be with them for the rest of their lives. They can have changes in the way their puberty progresses, in their menstrual cycles.
Now, is there anything, as far as obesity, and I don't know if this is true or not, but I've read that because young girls are heavier earlier, that they're menstruating earlier on. Is that the case? Is that science, or is that just
Some
anecdotal?
of it's related to obesity, but most of it's related to nutrition.
Okay.
The triggers that start puberty are very much related to nutrition worldwide, and if you look back through evolution. So now girls are getting better nutrition, so they are getting their periods and starting to develop and have and go into puberty much earlier.
And that's related to nutrition. That's interesting. Now, when should someone come see you for the first time? So if there's moms out there or grandmas out there who have young girls, when should they come see you for the first time?
So the recommendation from our national committee, the American College of Obstetrician and Gynecologists, said that girls should come between the ages of 13 and 15.
Okay.
At their first visit, probably we're not doing an actual pelvic exam, so the girls don't have to come and be completely afraid that they're going to have to experience something that they've never experienced before. So we like them to come a little earlier. We can talk about things like their nutrition, the HPV vaccine, make sure they're getting that, safe sex, and contraception, and just kind of open the door so that they're comfortable when they start encountering all these issues to come back and
be able to have those conversations. Yeah, okay. Exactly. And on the other end of obesity is eating disorders. Are you guys trained to recognize that, and what are some of those effects on young adolescent health?
So anyone that comes in that's a little underweight, of course, is a red flag to us now. Most of our patients are normal to overweight. So if they're on the lower end, we definitely ask questions regarding their eating habits. If their parents are there, asking questions about, are you eating dinner with her? Does she avoid meals? She always saying, oh, I ate at the neighbor's before I go, or I'm going to go eat upstairs. Do you see her eat? Does she have a poor body image? She's always saying negative things about herself and her body.
You mentioned body image, and I think that's really, really important, especially with social media, bullying, things like that. What can parents talk to their girls about as far as body image, and how does that relate to kind of what you see in the office?
I think a lot of it relates to what their parents say to young girls. If the parent's always saying, "Oh, you're overweight, you shouldn't eat that," it's always a negative message that you're sending to your daughter. She's just going to embody that negative image.
Some sort of role modeling is obviously very important.
Yes.
You also talked about the HPV vaccine. I think it's controversial. What's the story on it?
I think it's becoming less controversial for the young girls now. They're starting to introduce it into the to the young men. So that'll, I think, is going to be the new controversy. It's recommended for girls ages 11 and 12 usually. We can give it like all the way down to the age of 9 if a girl is starting to become sexually active or if we have concerns regarding that. It's 3 vaccines given, 3 separate shots given over 6 months. The most likely side effect is pain or a little redness at the injection site.
Okay.
Maybe.
And what does it do? What does the vaccine do?
So the HPV vaccine, there's two types of them. One protects you both against cervical cancer and genital warts, and another one just has strains for cervical cancer.
Okay, and which one, I guess, how do you decide who gets
It's really
what?
up to the parents. So a lot of the parents have concerns that this is going to encourage their daughter to go out and have sex and think it protects her against everything. So if they prefer the vaccine that doesn't include the 2 HPV types for genital warts, we could do.
And why is that HPV vaccine so important now? You, from a doctor's perspective, talk about the importance of I guess, getting that vaccine or the alternatives to not, and kind of where science stands right now.
So the HPV virus causes a majority of cervical cancer cases that we see throughout a woman's life. So
women who, let's say, are older, let's say in their 40s or 50s, that could be from the HPV virus.
Yep.
And if they got a vaccine, let's think longitudinal now, if they got a vaccine when they were 15, that would help protect them when they get into their 40s and 50s. Or
right, it's like a vaccine against anything else. You develop an immunity to it, so that if you're later exposed to the virus, you'll have that immunity and be able to prevent the changes in the cells at the cervix. And
how about regular exams? So we talked a little bit about adolescent girls. You said 12 and 13. When should those regular, pap smears and pelvic exams, when should that start? I know sometimes they say a pap smear every 3 years, but insurance will usually pay for every year. What should women do?
So the guidelines have changed recently. We now don't do any pap smears until you're 21 years old.
Oh, wow, okay.
So, and that's because so many of the girls, if they are exposed to HPV, the body has a way of ridding itself of the virus. So a lot of the abnormalities that you'll see in the teens and early 20s will be resolved with time.
So the body can resolve itself if a young woman was to get HPV virus, it can resolve itself?
It can.
Interesting, okay.
But if you test positive for HPV and have an abnormal pap smear, you need to come back. We need to make sure that your cells don't progress down the line to cervical cancer.
And what other, regular exams throughout a woman's lifetime, what else should we be doing?
So your pap smears during your 20s, we recommend if you have a normal pap smear, it's every other year now.
Okay.
Into your 30s, we can go to every 3 years.
Wow.
Regardless, you should still come for an annual breast exam and an annual pelvic exam, just to make sure there's nothing else going on.
Okay. Any other hot topics out there right now in your world as a doctor that's kind of on the forefront? I know there's some new research out about, I know you guys don't directly deal with this, but breast cancer and other like ovarian cancer. Can you talk anything about those topics at all, or kind of what you see or signs or symptoms that you see when you'd recommend someone to an oncologist?
So we do have a lot of questions, a lot of women coming in and wanting for screening test for ovarian cancer. And like breast cancer, there is no mammogram that I can send you for to test for ovarian cancer.
Sure.
So you should get your yearly mammograms after the age of 40. We're still recommending that. For ovarian cancer, it really is based on your family history. And also if you come in, I feel something on exam, or you're having other issues like you feel like your belly is getting very large very quickly, changes in your bowel habits, feeling like you're getting very full very early.
Okay, excellent. Now, obviously, teen pregnancy is an issue. There's shows on television that highlight it now. What are some recommendations? So let's say there is someone out there that's young and finds themselves pregnant. What should they start doing? When should they come see you? I know sometimes on those shows they say they don't go to the doctor till they're 5 months along. Talk a little bit about what you should be doing and when.
So I would recommend any teenage pregnant female to come see me as soon as possible. We start you on prenatal vitamins, make sure that we do targeted ultrasounds to make sure that the baby is developing normally. And a lot of teen pregnant girls need a lot of emotional and social support. They may be hiding the pregnancy from their parents or from their friends, and there are ways that we can help them negotiate the different channels.
Well, Dr. Schultz, thank you so much for coming on the show. These topics are kind of difficult to talk about, I think, sometimes. So thank you for bringing light to it. And I hope we can continue on the show to have the conversation about the health of teens, just with social media and nutrition. And there's lifelong effects to staying healthy when you're that young. So thank you so much for coming on the show. Welcome to Woodbridge. Good luck over at Bay OBGYN. And we'll be right back.
A beautiful day at the Woodbridge Community Center Skyline Mini Golf Course for the first annual Skyline Mini Golf Championship. If Katie can sink this putt, the championship is hers. What a shot! She sinks the putt and is the Skyline Mini Golf Champion. Let's go down to the green.
So Katie, tell us how you did it.
Well, it's all my time spent here at Skyline Mini Golf Course. With its 18 holes of golfing fun and its stunning view of New York City, it's the perfect place for me to practice. And a great place for our private parties, corporate events, and birthday parties.
That it is, Katie. And congratulations on your championship. Skyline Mini Golf Course, where legends are made.
Welcome back. My next guest is Sean Coyne, a behavioral biologist out of the University of Chicago, who recently returned from a trip to Cayo Santiago, Puerto Rico, also known as Monkey Island. Sean, welcome to the show. Thank you so much for coming on.
Thank you for having me.
So we're here to talk about monkeys, but the reason you're on Wellness Woodbridge is because some of the research you've done relates back to human behavior.
That's correct.
So I guess tell us a little bit about what your degree is in and what you've been doing for the past 18 months.
Okay, well, my undergrad was in animal behavior, which is how I got kind of involved in the monkeys, but it's really my graduate work. So I just finished my master's and I'm heading to now start my PhD at the University of Chicago, and the department is comparative human development. So we have a whole bunch of different people. We've got people that study animals, people that study people, and it's all kind of a mix in just how people develop, whether it's on the evolutionary scale or whether it's from a baby to a toddler and throughout their lives.
So down at Monkey Island in Puerto Rico, I guess explain what Monkey Island is first to people.
Okay, so it's actually a colony. We have about 1,000 rhesus macaques now, which are native to all over Asia. They're one of the most widespread monkeys on the planet, actually, and we brought them there in 1938. A man named John Carpenter brought them there. It was a joint effort between the National Institute of Health, Harvard, and Yale University, so we could study them easier than in their native India, because back in the 30s it wasn't super easy to get out into the jungles and study these animals. So we brought them to Puerto Rico, and they've just been flourishing there ever since. It's a little teeny island. It's about 34 acres, half-mile offshore. And
what kind of, you guys do more observation, not testing?
Yeah, no, it's all either social observations. We do collect non-invasive hormone samples from fecal and urine samples. Once a year we do get the opportunity to collect some blood samples because the island needs to, the census team needs to identify all the individuals. We do paternity testing to make sure we know all who's related to whom.
Okay.
And so we do get a chance once a year to get a little bit more
And
invasive.
there's no predators there. They're not caged.
No,
They're just
totally free-ranging. So it's not a wild population because they're not native there. So it's called a free-ranging population because they are allowed to do what they want in the confines of where we keep them.
Great, excellent. So what were you doing down there? I guess what were you studying?
So our research was investigating how early life experiences of stress affect the development of infants. So we followed these babies from the day they were born through the first 12 weeks of life, categorizing how much stress they received, whether it was from the mother, from peers, from other adults.
And how would you observe stress in monkeys?
So it's interesting. There's a lot of social pressures. Their whole world is centered around their social structure. They live in these female bonded societies. So moms and their daughters and their aunts and their sisters all always stay in the group they were born in. Males, when they start to hit puberty, they move on to a new group.
Okay.
So these females have strict social hierarchies. The daughter inherits the rank right beneath her mother, and it goes in reverse birth order. So your youngest daughter will have the rank right beneath you. Your oldest daughter will be the lowest ranking one.
Interesting. And then, so you observed stress in them and how they react.
Yes, because there's stress when they're playing. You know, some of the older kids want to play with the new babies, but they don't understand that the babies don't know how to play yet. So they'll drag them or they get into rough and tumble play, but the babies don't know how to do that. So that's stressful. the babies want to nurse all the time, but moms have to wean them, and that's, of course, a very stressful situation. That especially peaked around between 3 and 9 months, and the highest peak is right around 6 months.
And so how does what you were directly working with, how does that relate to humans?
So we're actually testing this theory called stress inoculation, and what we're hoping to see, the old theory was that the more stress you experience in development, the worse your later life outcomes would be. So if you were very stressed young in infancy, your developmental pathway is going to be all messed up. But what we actually are trying to show, and what recent evidence has demonstrated, is that a little bit of stress early in life is actually a good thing, because life is going to inevitably be stressful sometime down the road. So if you have some experience with it when you're young, you know how to cope. You develop coping mechanisms for stress later on in life. If you didn't receive any stress early in life, you have no idea how to deal with it. So then it really blindsides you.
Interesting. So how long does it take from what you guys are doing on Monkey Island to get to, I guess, mainstream human behavior, talking about it in, Parenting Magazine? How does that work?
It'll probably be, we're on a 5-year project right now, funded through the National Institute of Health. So we'll finish collecting our data, and I guess that'll be around 2016, 2017. It'll take us about a year or two to publish all of that data. And so it'll probably take another 2 years to really make it mainstream, because then other labs will see what we publish and come up with further ideas. So I'd say probably you won't be seeing us in the mainstream until probably around 2020 or so.
Interesting. So now, what else is going on? I know it's not just the University of Chicago down there. What's some other research that's coming out of Monkey Island that's kind of interesting?
So there's a really good project out of the Platt Lab at Duke University, and they're studying a monkey model of autism. Okay. So we have some ideas of which genes are involved in possibly in the development of autism, and so
in monkeys.
In monkeys. And so, as well as they're starting to see they're hoping to see some parallels in these genes in the monkeys in humans as well. That's why they've genotyped, this lab has actually genotyped the entire island, so they know the entire genetic makeup of every monkey on that island. And there's a population, about 10% of them, who have different genes, and they seem to be less capable at engaging in appropriate social reactions, kind of like what we see in autistic children. They don't always read the social cues correctly, or they find it difficult to communicate properly and things like that. So we're trying to see if we can model see what genes exactly in the monkeys are responsible for sometimes these inappropriate social behaviors, and if we can find then those genes that are responsible for this in humans as well.
Interesting. That's really cool. What else is going on down there?
There's some fun stuff.
This is really cool stuff. I guess there was one about stress levels and cognitive function,
yes,
which I think relates to everyday humans, adults, and beyond.
Absolutely.
So talk about that.
So we're doing that in our lab as well. We're testing this very simple paradigm. What you do is you kind of walk up to this monkey. We have a large cardboard thing. We can put 2 pictures of it. We show them the picture, same monkey face. We show them a face of a monkey, same individual, but one face is a negative, it's a threatening face, and the other is just a neutral face. And we see which one they look at first, how long they spend looking at each face. And what that's supposed to indicate is if they're very stressed, they should be biased towards the negative stimuli. So a stressful individual is going to be kind of thinking negatively, and they're going to be attuned to this negative face. So they should look at the negative face quicker. They should look at it for longer periods of time. And yeah, so that's a very simple way of kind of gauging that.
And then you did your undergraduate studies at Bucknell, and you worked with some primates there, I guess I can call them, right?
Yes, yep.
Talk a little bit about that. It's kind of interesting.
Okay, so I worked with Hamadryas baboons, which come from...
Those are the big ones.
Those are the big ones. They come from Ethiopia and Kenya, and you can even find them... They used to range into Saudi Arabia. I don't think as much you'll find them there anymore. But they're a very aggressive society, also have a very strict dominance hierarchy. And so what we found was that when 2 individuals fought, it's a very well-known fact that those individuals are then going to be stressed.
Sure.
What we demonstrated in our lab was that a 3rd individual who was not involved in the fight their stress levels will also increase. But what's most interesting that we most recently found was that if that 3rd individual who was not involved in the fight watches the aggressor and the victim reconcile, their stress levels will turn back to baseline, as if they're recognizing the functional value of a reconciliation.
So relate that to humans.
So it could be,
let's say parents have an argument and a child is watching.
So parents sometimes, they think, oh, they don't understand, or they're younger, they don't realize that we're fighting. But, we definitely perceive these small social changes. So not only that, but it's also important then to kind of talk it out as a family, perhaps, or just let the children see the reconciliation, because we can understand these social cues, even if they're nonverbal, about a reconciliation. Because obviously in the monkeys, it's all nonverbal. It's after they fight, they'll go groom each other. So it's small, subtle things, and you definitely just have to give credit where credit's due, that people are going to perceive either tension or calmness between pairs of individuals.
So it's so interesting, I think. And then what do you anticipate you're going to study in your doctoral program? How are you going to kind of continue?
So I'm hoping actually for my dissertation to study how hormones are affecting development and social behavior. I want to follow these babies that we've already been following since we have all of this data on them from when they're born, and I want to see how their choice in social partners is affected by their hormonal profiles. So essentially, before we have puberty, we have what's called adrenarche, and it's your first dose of hormones that the body gives you. Both boys and girls will just get a shot of adrenaline that comes through the adrenal gland, and these start to develop your secondary sexual characteristics. And that's when we see them go from mixed social groups where boys and girls will play together, and then we see this.
We see this at the Y. We see it happening in our camp and in our aftercare programs. So it's just really interesting of what you're kind of doing out there on this island, this very small island outside of Puerto Rico. It's just really interesting that that's kind of what socially we see.
Oh, absolutely, because you see it when from around 3 years old, boys and girls will play together. They have no concept of, oh, that's us versus them. As soon as they turn about 4, this adrenarche happens.
In monkeys.
In human children. Monkeys, we're not really sure when it happens. So I'm trying to see if I want to see if this is a unique human characteristics where we have this, like gender identity and these roles where we assume, oh, I'm a boy, I play with trucks, I don't do girly frilly things, and the girls will say, ew, boys are gross, they have cooties. But we do see this somewhat in the monkeys. They'll start separating, and the boys will only play with boys, and the girls will only play with girls. So I want to see if this is hormonally responsible, if the moms are maybe regulating them, choosing their social partners for them. So there's a lot of research to be done.
And I guess, Sean, what else? What else kind of other stuff? Who else is on the island with you? What other universities are there? Sounds awesome.
It is a lot of fun.
People can't visit, right?
People can't visit. You can kayak. You can kayak around Monkey Island, but there are some health issues with, you need to go through medical clearance and all these various things to get onto the island, both for the human safety and the monkey safety. But there's a lab that doing a lot of work from Yale University, who we actually collaborate with. They do a lot of fun cognitive tests, so they always have these puppet shows, and they're using tools, and it's to see if the monkeys understand, like, oh, see if they get confused, because we just use looking time paradigms essentially. So if something happens the way it should, monkeys aren't interested because that's the way the world works. So they just they'll walk away. But if something,
like, what do you mean? If things happen like they should?
We trick them. So we use these optical illusions. For example, one of my friends did we call it the lemon stick. So what she did is she had like 8 lemons on a skewer essentially, and she would put it in a cup, and obviously it shouldn't be able to fit into the cup, but what the monkeys don't know is there's just a trap door. So sometimes she could fit the whole stick of lemons in the cup, and it can't physically fit in there. And the monkeys, you would have to see their reactions. They're like, and they really are so confused by it. So they really do kind of have this concept. We're trying to see what concepts they have. Do they have concepts of time, space?
Do they have like a sense of humor? Like, do monkeys have a sense of humor? Like, are they intrigued because it's silly, or are they intrigued because it's different?
I think they're intrigued because it breaks the laws of physics that they understand. Like, something like that should not be able to fit in something like that. But we do like to think that the younger ones, the 1- and 2-year-olds, who aren't worried about mating yet, have all this time on their hand because mom's already got a new baby. So they have nothing to do other than mess with the researchers. So they'll steal our pens, knock our hats off, always pull on our clothes. And
how long do monkeys live? Like, how?
So these rhesus macaques, some of the oldest were up to close to 30.
Really?
But I'd say on average closer to 20.
Wow.
Yeah.
Very cool stuff, Sean. Very cool. Again, how would some of that stuff that Yale's doing, how does that tie back in? How are they tying it back into human behavior?
So that's all cognitive things, and what they're trying to see is what traits do we share with these monkeys? If humans show these biases, do monkeys also show them? Because if the monkeys also show the same cognitive biases, then we know that this is a very entrenched thing in our evolutionary history that's going to be very hard for us to change. She's doing a lot of economy things where they actually trade tokens for things, and she sees what types of behavioral patterns that these monkeys engage in, and is it similar to humans? Because if it is, then
we could have maybe stopped the economic crisis,
Or-
Sean? Is that what you're saying?
or how much work we have to do if even monkeys can't get it right, that we're really going to have to work hard to overcome these biases.
Really? Now, other people in your program, everyone that's in this is a behavioral biologist doesn't study monkeys. So I guess, what do other people study that do kind of have your education and your credentials?
So some of the people in our program are studying, for example, one of our, not in our lab, but one of the labs that we are friendly with, he's studying, he's playing callbacks from dolphins to see if that have been separated. You know, so they used to live at one place together and then they got separated, and maybe they've been separated for 5, 10, 15 years, and he'll play their clicks and whistles and they'll recognize.
Really?
They recognize friends that they used to live with that they haven't seen in 15 years versus clicks and whistles from a dolphin that they've never known.
And then some people study humans. So
Exactly.
like you're on Monkey Island and you're studying, I guess, monkeys that are contained. Some people probably are studying a preschool classroom.
Oh, absolutely.
Which is
Yep. And they'll study, you know, dynamics of how supervision affects behavior. So you study them in the classroom and they're all nice and behaved, and then you study them on the playground where there's not much supervision or less direct supervision, and then see how, you know, same thing, see the gender roles or how they'll separate. Do they separate based on, oh, I don't know, like socioeconomic status? Do they even have, you know, because they shouldn't have a concept
of
these things, but
Yeah.
sometimes you'll see these weird patterns that do emerge, and I don't even think the children realize it. So it is a lot of interesting things.
It's just interesting. You're saying kind of the same things of preschool versus, you know, I don't know, it's interesting. Now, there was one study you talked about, grapes on a plate. What is that? This is
Okay,
fun.
so it's basically just, it's called theory of mind, and we're trying to see if it's a big debate of whether monkeys have this ability. Do I know, humans have it, so I know that you have a brain and that you can think something that's completely different from what I'm thinking. People can't tell if monkeys have this or not, so a simple test is to see, do they know where we see? Because then they can kind of gauge off that. So if we had 2 plates, we were both facing in the same direction, and then I turn my back, I have a grape on my plate, and you're facing the plate, the monkeys will consistently come to my grape because they know I'm not looking at it.
Isn't that
and they know
interesting?
you are looking at the grape, so.
And what are, I guess, Monkey Island, people know what Monkey Island is. I didn't, but I do now.
Some people do.
What else do the monkeys do? Is this where the monkeys have gone wild? Like, do they...
I mean, so the population's so large for an island so small that we
Yeah.
do have to provision them with some food, Purina monkey chow.
Okay.
It's commercial monkey biscuits, but other than that, we just let them be. So I mean, there's so many monkeys, and there's trees and bushes, and there are lots of other animals, lizards and things. So there's tons of wildlife for them to just kind of do what they want to do, which is sit around, groom, fight, explore. They're very happy down there.
Excellent. Well,
Yeah.
it sounds awesome. Where can you go, I guess, is there anywhere people can, like, watch videos or get more information about just what's going on down there?
Not really.
It's like just research.
It's kind of pretty much just research, and so
Wow.
for safety reasons, we kind of limit how much is out there. There is a website. It's called the Caribbean Primate Research Center, so if you did
Okay.
Google that, it has some information. And I believe, I'm not 100% sure, but there might be a documentary coming out about it in
Very cool.
in the next year or so.
Fascinating stuff. I think it's awesome. I think you should talk to kids about this too, just as far as like what they could do with whatever degree. It doesn't all have to be marine biology and dolphins.
Yes.
So very cool. Sean, thank you so much for coming on the show.
Thank you
I
for
should
having
give
me.
you some kudos. How I met you was your sister works at the Y. She's the senior program director
That
there,
is correct.
Erin. So Sean, thank you so much for coming on the show. I hope people learned some things about kind of research and what's going on out there. And we'll see you next time.